guys, it's me again. My name's Imelda. I am here to talk about my journey with UTIs, and this is my second video. I was gonna ask what you guys think of Heparex. I've been on it for maybe 2 months, and I take it with vitamin C. I don't know if it's helping or not. I'm not sure. I've been having body aches and chills for like a month and a half. Not continuous. Some days I feel fine and some days I don't. If it's warm outside, I feel fine. But once it gets to the 50s or 60s, I don't feel very good. I'm going to have a CT scan tomorrow to hopefully see if it's my left kidney or what's going on. And then I have a doctor's appointment. Some people are like, maybe you're anemic. Maybe you have a thyroid issue. I don't know. But that's some of the things I'm doing. I think I'll go back and just talk more about my journey. I started getting UTIs. Oh, well, I recently learned that I did have a UTI when I was born. And then I think I had one as a teenager from my mom. And I don't think my parents did anything about it. So maybe I was giving antibiotics and that's about it. And then my UTI started when I was 19 years old. I got married and I started getting UTIs at 19. And then after that would just get them all the time. And I didn't know why. And at this time I didn't know anything about the medical field and how to work it. Maybe if I had known, I would have immediately said, can I have a CT scan or an MRI or ultrasound? But I didn't know anything about it at that time. So for years, I think until I was maybe 27, I said, you know what? I'm actually going to find the root cause of this problem, not just keep putting a Band-Aid on. And I didn't know at that point that antibiotics, you become resistant to them over time. I didn't know that. I just assumed, I'll just have to take antibiotics and it'll go away. And if it comes back, I'll take more antibiotics. Well, 27, I started trying to push more, trying to find more information, trying to figure out why I was getting these UTIs. I saw more specialist, and I would see multiple, just trying to figure it out. And I don't think I was getting very far or anywhere really. It wasn't until I was pregnant in 2022 with my daughter that I already had an appointment scheduled to see this urologist in Louisiana who's a specialist, and he prescribes long-term antibiotics before I became pregnant. So then when I got pregnant, I ended up getting UTIs and kidney infections, just UTIs and kidney infections all the time. But I finally was able to see him, and he put me, I think, on Augmentin for the rest of the pregnancy, which I was really worried about my daughter having issues because I was on this strong antibiotic. So when I went in to visit him once, and we had to drive. It was like a 6-hour drive, about that, from Austin. We went to visit him, and he did an ultrasound on my left side. And I'm assuming because my baby was pushing up against me, this is just my guess, they were able to see that the top portion of my kidney was dying. I don't remember if he also saw the duplicate ureter. Maybe he did. Maybe he saw it at that time. And then he's like, this is what we're seeing. And I don't know if I asked him if that could be causing my UTIs. Maybe he said maybe it could be. And then after I was done being pregnant, I immediately went and got a CT scan. And that's when they saw I had a duplicate ureter on my left side. I think I also have one on my right side that has no problems. And that the top portion of the kidney had died. I think if my parents, or even if doctors had listened to me when I was younger, I think maybe more of my kidney would when more of my kidney wouldn't have atrophied. And so I was able to see a urologist here in Austin, and he, the bad thing was that I thought, okay, I'll get surgery next week. No, I had to wait. I went in to see him July. It wasn't until October. And that's a long time. And so I had to stay on those antibiotics for that time as well, waiting and waiting. And finally I had surgery, and then I was still on the antibiotics for a little bit. And I think I had a little bit of pain on my left side. I would have some left pain, but we would do ultrasounds, MRIs, whatever. And it always came back negative. So, but then I was like, oh, I'm not getting UTIs. And then 2 years after, I was like, I'm cured. I'm finally cured. This is amazing. 2 years after, I started getting UTIs again. And but these UTIs were different than the previous ones, because before I would know I had a UTI because my pee would be cloudy. So immediately I would know. Now these UTIs are more like, I think I get a weird feeling down there, and then it burns sometimes when I pee. And so sometimes I'm like, oh, it's not a UTI. I don't know. At first I didn't know, but then after a few days, I was like, I think I have a UTI. So I went to the doctor, antibiotics, just more antibiotics. And then I kept getting them every few months after that, which is still very confusing to me. I don't understand how I was clean for like 2 years without, I didn't have any UTIs. And then all of a sudden I started to get them again. I don't know. Well, like I said in the beginning, I'm going to get another CT scan. I have gotten an MRI, a urogram MRI, and that was fine. And I might have gotten some other imaging done too. That's fine, but I don't know. It's kind of crazy to say, but I keep hoping it is my left side so that I don't have to keep dealing with UTIs. I am also, I recently did a solo trip to Mexico and brought over Euroimmune. I got it myself. I was pretty proud of myself for doing that. I was like, wow. So I went out there and I did that by myself to get Euroimmune. I think one of the things that's very difficult is living in a country that should have decent health care, but you can't find all these vaccines that are available to other countries. You have to go to Europe, or you have to go to Mexico, or anywhere to get these vaccines, and they're not even, some people say they're not even effective for them. You spend all that money and you spend that time, and then you go out and get these vaccines, and you don't even know if they're going to help you or not. So I am on Euroimmune. I think I'm going to end the first dose on the 8th, which is 3 days from now, and I'll be done with the first dose. It is interesting because it's sublingual, so it goes under the tongue. You have to take it early in the morning before I think you can't eat or drink 30 minutes prior. You can't eat or drink anything, and 30 minutes after you can't eat and drink anything. So I take that, and then I wait that time, and then after that I have to still taking antibiotics. I had some tests done through Microgen. I don't know what you guys think about Microgen. If you guys prefer it, it's more expensive, which I don't like. So, and I don't think my insurance didn't cover it. So I don't know if you guys' insurance would cover it. And my Microgen always shows that I have E. coli. That's what it shows. So I don't know. But right now my symptoms are just body aches and chills, and I'm hoping the CT scan can rule out, or the kidney, kind of hoping it is the kidney, because at least then they can remove it, and then hopefully I can live my life without any more UTIs instead of having to wait for trials or wait for vaccines to become approved. I don't know what you guys think. Thanks for listening to my video. It's a lot of blabber. It's not very organized, but it will get better. Okay, thanks. I'll see you guys next time. Bye.